Well, it's a word we all know, unfortunately, too well. But how much do we know about it? The word I'm referring to is cancer, and today we're breaking down what metastatic cancer is and how it can be treated with the CyberKnife robotic radiosurgery system. Here with more is board-certified radiation oncologist, Dr. Douglas Rivera. Good morning, doctor.
Good morning, Stephanie.
All right, so we've got some school to get through today. I'm going to pick your brain a whole lot here. So buckle in, folks. You're about to learn some great information. Let's get started, Dr. Rivera, with metastatic cancer and what it actually is.
All right, so a lot of people are generally familiar with tumors. There are ones that are benign, which just grow in one place but don't go anywhere. And when something is a cancer, it has the ability to spread and go to other parts of the body, basically, skip somewhere else.
Okay, all right. And I did tell you off camera a little bit, I am the student here. If I understand it, if it's edible for me, it will be for viewers at home too. So check, check, check. I get it now. But let's talk about how cancer cells actually spread. I want to know what that spreads like, how it happens, and what area of the body cancer can actually affect.
Right. So it depends on the type of cancers. There's many different types, as you know, but what makes them cancerous again is that they can grow and then go into things called blood vessels, or even lymph nodes. And when it does that, it can spread to different parts of the body. So depending on where it starts, it can go somewhere else. One thing that we've seen is it goes to the brain, and they call that brain metastases. Different type of cancer can go to the liver. It can go to the lung. It can even go to skin or other parts of the body. So there really isn't a place that it can't go. There are places that it goes to more often, the ones I just mentioned.
Okay, doctor, let's talk a little bit about Austin CyberKnife. Now, cancer is treated with the CyberKnife robotic radiosurgery system there. Can you tell us what CyberKnife actually is?
So CyberKnife is a really specialized radiation tool, very unique in that it can treat things very precisely and things that are moving. Sometimes, let's say you have a cancer, it goes to the lung or the liver, and you want to treat that area. But when we have patients in there, they're breathing, so that tumor is moving around. So this thing can really target and lock onto that and kind of move with their breath so that it can more precisely treat it and really expose very little normal tissue to the radiation.
So you've painted a really good picture for me. Again, visual learner here, such a student. You get another check mark there, doctor. Now, let's talk about the benefits of using CyberKnife for cancer treatment. What are they?
So what we've learned over the last few years is that sometimes when patients have tumors that go somewhere else, whether it's one or two, oftentimes there's lots of things we do for that, but one of the things we can do is to just spot treat that lesion. And studies are starting to show, really over the last few years, that if you spot treat those isolated tumors that spread somewhere else, you can actually prevent those tumors from not only preventing having little seedlings that go to other parts of the body, but potentially also killing that tumor might also make it so that tumor is not spreading any signals to other parts of the body that might have cancer cells as well. So we are showing that there is quite a significant benefit. In addition to helping if people have pain and other things, we're just talking about prolonging their life and also preventing it from spreading to other places, which is really important.
Mm-hmm. Okay. And doctor, for patients who have had radiation before, my understanding is that they can't go through radiation again. Is CyberKnife a good treatment option for those cases?
So it depends, but yes, it can be. So a lot of times when people get radiation, it's hard to treat that area again because of exposure to it. But if this particular instance, this actually is one thing we also use the CyberKnife quite frequently for. So if someone has had it and there's a new area where it's come back in the area again, we can really do a very focused treatment oftentimes to retreat that area where normally they might not be able to.
Good to know. Okay, and finally, the pandemic's been going on for a while. So as the COVID-19 pandemic actually continues, I want to talk a little bit about how Austin CyberKnife is safely treating patients.
Yeah, that's been a challenge for everybody. We are definitely following the best practices in terms of hygiene and infection control and everything else. But the biggest thing we do, because we have to still treat patients for their cancer, because cancer doesn't sleep, we do have the ability, though, to do a lot of telemedicine visits. I've been doing quite a bit of visits, either via televideo, such as yourself and myself right now, right? And we can talk to each other and interact, and that's the most important thing. or we do it over the telephone. But there's lots of different things that we can do for our patients to keep them at home and keep them safe, and also help with some folks who might live very far away. It's also to keep them off the roads as well.
Fantastic. Well, you're keeping us safe and you're keeping us very well informed. Dr. Rivera, I have to tell you, you ticked all the boxes for me. I now understand, everything we spoke about today. So thank you so much for your time and for, making it all very edible for me to, kind of knock off the list and get through as a student here. I appreciate you and we'll talk to you soon, okay?
All right, you take care. Thank you.
Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincyberknife.com for more info.